I'm Dr. Richard Goodvangen. I'm one of the OBGYN doctors here at the Brookings Health System Hospital. I've been here between 12 and 13 years and been practicing OBGYN for approximately 25 years. And in that time, delivered about 2,500 to 3,000 babies. Well, there's some big benefits of breastfeeding to mom. One is it helps mom actually get rid of the extra weight because breast milk is calories. It takes calories to produce those calories. It actually takes more to be breastfeeding than to be pregnant. It does immediately postpartum make the uterus go back to normal faster. There's actually less bleeding overall. Decrease in things like anemia because mom's not having periods. And that's one of the ways to run into anemia for especially modern women where they're not pregnant all the time and they're not lactating all the time. One of the biggest ones is probably the reduction in breast cancer risk. Moms that have the breast cancer gene in their family, even there, they can reduce their risk by 50 to 60% if they breastfeed. Moms that breastfeed miss much less work, pure and simple because their babies are not as sick. You don't have to worry about sterilizing bottles, washing bottles. The milk is always the right temperature. It's sterile to start with. They cost less. Moms that formula feed supposedly cost as much as an extra $5,000 for that baby's first year of life. Not for the formula, but because of the illnesses. Well, it's important to, at least in the first hour, that baby try to nurse, because babies have a way of, after the first hour, they become lethargic, sleepy for one day. Second day, they become a whole new kid. It's like they're programmed to know that milk production is going to start. Initially, it does seem like a major hassle, and you have to survive the first 2 weeks. Once you get through that, then it's much straightforward. You don't spend your life breastfeeding, but babies are going to want to be fed for the first 3 months every 1 to 4 hours. First few days at home, they may want to be fed as much as every hour. It's like they're programmed to demand attention. And so the first few days, first couple of weeks are tough, but then it becomes easier after that. It becomes very routine. That's usually where breastfeeding fails, when moms go home and all these well-meaning people tell them how to do it. Well, that's part of what happens in that first 2 weeks when you develop a letdown reflex. Prolactin gets produced when baby suckles and stimulates the letdown reflex, stimulates milk production, and that's not there at first. And so that's why I say the first few days can be tough because there is no letdown reflex and there is no prolactin being produced. Once that happens, milk production is there whenever baby needs it. The more baby nurses, the more mom will produce. And so there is no such thing as not producing enough. 1, babies are pure and simple healthier. 2, moms are healthier. 3, cheaper. And 4, make your kids smarter. 5, decreases your chances of, mom's chances of diseases herself later in life. It's a good place to have your baby because we're here in town and you have a very high likelihood that your doctor will be around. Not always, we need a break once in a while, but most of the time we're here. We have all the amenities, we have everything you need. We can take care of almost every obstetrical issue, and so that should not be of concern. We have great staff, and one of the reasons I ended up coming here was because they had all the amenities. I was impressed that we had everything we needed here. And I came from a much larger community to come here, where there are numerous hospitals, all the high-tech stuff. I came here and it's like, wow, almost everything is here.